Hello and welcome to this introductory episode of the Nutritank Podcast. I am your co-host, Dr Iain Broadley, NHS-trained doctor, co-founder of Nutritank, and currently working in Melbourne, Australia, gaining some experience in a different country's healthcare setting.
And I'm Luke Zollman Thomas, the other co-host on this podcast. I'm a passionate Nutritank team member, and I'm studying nutrition and psychology for my undergrad in Newcastle.
So we're going to be taking it in turns each episode and interviewing leading experts within the field of lifestyle medicine, food systems, and nutrition. And our aim is to empower you, the next generation of change makers and healthcare professionals. We believe that the valuable knowledge that we gain from our guests will hope to inspire you to act and join the movement in creating a healthier population.
Absolutely. And we're so excited to take a deep dive into each of our guests' kind of expertise within their space. We're going to do this through the lens of individual health, community health, and their plentiful intersections and kind of almost symbiosis. So in these episodes, we want to tackle the biggest questions that are facing us in this space with our guests. And we want to explore this as individuals and as communities and groups. So how can we come together to do this as well? So onto the guests. I'm so excited to speak with such a wide variety of guests in my interviews, from junior doctors making big waves in the space to some of the leading authorities and voices on British food culture, to consultant neurologists taking a metabolic approach to health, to experts by experience, people who've had cancer and treated themselves in an integrative way when the system wasn't giving them that opportunity. And finally, looking at innovating, groundbreaking GP practices in the UK, creating some of the first real holistic practices that we can see. Iain, what are you excited about with your guests?
So I'm going to be interviewing leading educationalists who are bringing innovative lifestyle medicine consultation practice into their universities and inspiring and educating the next generation of doctors and how to provide diet and lifestyle advice to their patients. Also going to be talking to an experienced children's educational psychologist who has brought nature therapy into her clinical practice, and talking to a famous and very outspoken farmer who's innovated organic farming within the UK, and lifestyle medicine doctors who are utilizing community initiatives to really transform the health of their patients and their practices, and hopefully hear some really impactful patient stories.
Amazing. And whilst we do believe in the power of a great conversation to create a ripple in people's lives, we want our audience to leave feeling galvanized, feeling like they know what their next steps can be. So at the end of each episode, we try and ask our guests some of the same questions. So we're going to have one self-care tip from our guests, one community strength and action, strength to cultivate and an action to do, and then finally one resource, something that they believe can further our journey on this and give us a bit more inspiration.
Really looking forward to really hearing about those resources, and we're going to link all of those resources into our show notes so you will never miss them and be able to utilize them practically starting from the day you listen to the episode. So join us on this journey with myself and Luke, unlocking the wisdom and practical knowledge of these health leaders so that we can start utilizing their knowledge today in tackling the rise of chronic lifestyle-related disease and create a healthier population.
Can't wait.